The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. And on the occasion, if a patient is online with us, welcome to you. I am Tony Urbanic, and it is a Tuesday, and therefore we are here for the next episode of TMD Demystified. Today's topic is profound. Today's topic is extremely important. I have touched on it many times before, but I find after discussing TMD with not only my colleagues, my dental colleagues, but certainly patients, that no matter how many times I cover this issue or material, it is constantly misunderstood. So times over equals certainty, times over a particular topic or piece of data, the more likely it is that it will impinge on the person and they get to the point where they understand it. So the title of today's topic is Inflammation Drives These Symptoms. Inflammation drives the symptoms. Symptoms of what? Symptoms of TMD. But we're going to leave it as inflammation drives the symptoms. That was the profound thing that I discovered. It should have been obvious. I didn't really discover anything that hadn't been in the literature, it hadn't been written on and carefully studied academically, scientifically for decades. It's just a matter of connecting the dots, connecting the information that's out there that actually describes and shows what is really going on with this thing that everybody calls TMJ, more properly called TMD, temporomandibular joint disorder, singular disorder, not disorders. It's not a set of disorders. It has a set of disparate symptoms, but symptoms are not disorders. Symptoms are symptoms, which is one of the points I want to make. I mean, it absolutely blows me away that educated dentists and physicians, you can throw them in the pile too, and nurse practitioners and physician's assistants confuse symptoms with disorders. No, a symptom is a effect of some kind of disorder. If you have diabetes, there are many, many different symptoms that you can come up with if you have type 1 diabetes. But the symptoms of diabetes are not diabetes. They are the symptoms of diabetes. And the symptoms of temporomandibular joint disorder, singular, are many. And I'm going to reel them off in a minute. We may talk about them, maybe at length. I don't want to bore you. But if you do not understand the disease, you can't possibly understand the solution. And that is actually what I discovered. I discovered actually the mechanism that creates the symptoms, the mechanism that has a common denominator, and that if you fix, delimit, stop the common denominator of the disease, then you fix the disease. You have no more symptoms. The symptoms go away. If you actually remove the common denominator that creates the symptoms. And the way I just said this, I can't think of a way I could say it better. I'd love to think that my speech is very erudite, but it isn't. I'm just a plain-spoken guy that actually connected the dots, that figured out that inflammation in the joint creates the symptoms, and the mechanism, the autonomic nervous system, muscular mechanism that makes that happen. And we'll explain that in a minute. I won't leave you hanging. But again, it's like inflammation drives the symptoms. Why this was not, it is self-evident. It is self-evident because every doctor, every dentist, and probably just about every patient who has TMD, temporomandibular joint disorder, has figured out that if you use non-steroidal anti-inflammatories, aspirin is a good example, or ibuprofen, Motrin, probably works better than aspirin and has less side effects. But if you use an anti-inflammatory, it decreases the symptoms. The problem with non-steroidal anti-inflammatories is that they have time, they only last a short period of time. You take them for a week or two and they are not effective anymore. They run out of steam. They just don't work anymore. And every physician knows that, every dentist knows that, and probably every patient who uses non-steroidals for pain relief knows that. But what do non-steroidals do? What do non-steroidals do? Non-steroidals decrease inflammation. That's all they do. They're a good, effective way to decrease inflammation. So we know that this joint becomes inflamed after damage. What kind of damage? Well, there are only three causes, three types of damage to this joint. Three categories, three types of damage to this joint. The one that everybody focuses on is bruxism, clenching or grinding. Clenching or grinding is the same thing. You can clench and damage the joint. You can grind and damage the joint. You can clench and grind at night and it'll damage a joint. You can clench or grind in during the day and it'll damage the joint. But the point is, that is called bruxism, and that is one category that damages this joint frequently. The second category is trauma, acute trauma. A baseball bat to the chin, an auto accident, and whiplash is very, very common. Whiplash causes joint damage because when the neck goes back, it snaps the jaw open over the stops and overly extends the jaw, mandible, damages the inside structures in the joint. In a whiplash injury, that's very common, acute kind of trauma. In Tennessee, it's 4x4s off the back of a pickup truck, bar fights, and for the females, whiplash. And then the third I've spoken on category that damages the joint is functional malocclusion. Functional malocclusion is the difference between the two bites, bite one where the teeth mesh, bite two where the ball fits in the socket of the jaw, but everybody has two bites, and if that bite is significantly different between the two bites, they're not close, but they're spread apart, that can overload a joint. If you overload a joint, it breaks down, and so functional malocclusions can overload a joint, break it down. A secondary overloading the joint of a functional malocclusion is when orthodontists put traction on the jaw itself through the teeth. They think they're going to get the teeth straightened by putting traction on the jaw, and all they're doing is distracting the condyle, the ball out of the socket, damaging the joint. And whether it be within a few months or a few years, that patient will start experiencing jaw joint problems, TMD, temporomandibular joint disorder, because the joint was damaged. And it takes a while sometimes for the inflammation to take effect. And over a period of time, the inflammation gets worse and worse. The joint does not heal. You then develop what we call chronic inflammation, just inflamed. And the more it's inflamed, the longer it's inflamed, the more it's likely to create symptoms. So 3 categories to damage a joint: bruxism, acute trauma, and functional malocclusion. But what all 3 of those have in common is they damage the joint, and inflammation is the body's attempt to cure, to fix. That's what inflammation is. Inflammation is the body's attempt to fix a problem, wherever in the body that is. Inflammation is associated with bacterial infection, viral infection, traumatic problems. And it one way or another, inflammation is the body's attempt to fix. But if it can't fix a problem, just using the usual signature and cell types of inflammation, that develops what we call chronic inflammation, and chronic inflammation will create, in this joint, symptoms of TMD. So the common denominator of temporomandibular joint disorder is inflammation. And once you get past using nonsteroidals, what is the best way to decrease inflammation in this joint? That is, the answer is rest the joint, unload the joint, unload the joint. Well, the best way to unload a joint is to separate the back teeth, because 90% of the loads on the jaw joint are from the posterior teeth, from the back teeth. So if you remove 90% of the loads on the jaw joint, then the inflammation will go down eventually. And when the inflammation goes down, being the common denominator of all the symptoms, then all the symptoms go away. That's the solution. The problem is that the vast majority, like almost exclusively, of the dentists who try to treat this problem one way or another don't understand what I just explained to you. It's not taught in dental school. You're taught in dental school that this joint is unique, complicated, which it is not. The joint is not complicated. It has a unique position in the head rather than in the knee. It has two variable types of motion, a rotation and a translation, but that isn't complicated. It has a very unique name, gangliomo-arthrodial joint, kind of a funky kind of name, and the dental schools use the fact that it has a strange name to justify that it's complicated. It's not a complicated problem. This joint operates like any other joint in the body, and that is what is not taught in dental schools. As a trained with scientific credentials, degrees in cell biology and anatomy, I can attest that this joint operates like any other joint in the body, which is the antithesis of what dentists are taught in dental school. And I've never had a dentist disagree that that is what he was taught in dental school. It's unique, it's complicated. We don't know how to treat TMD. It is so difficult. That's why it's a complicated thing. That's why we haven't come up with a solution. That's just the justification out of dental schools. And it's getting worse. It's getting worse in dental schools because they have less and less time to treat dentists how to be dentists because of all the different technologies that are coming through the pike in dentistry. So it's not the young dentist problem. It's really a problem of having the time to go through the different problems that face the dentist once he comes out in practice. And TMD is way down the list as far as dental schools go. That's a fact. All right, so let's go back to the title. Inflammation drives all the symptoms. Well, what does that really mean? Well, I'm going to explain that again. Just to give you the total picture, after doing personally, I did over 2,000 temporomandibular joint surgical cases in the first 36 years of my career. Half of them through open joint surgery, where you make an incision in front of the ear, do whatever you're going to do inside the joint. Remove the disc, replace the disc, put an artificial disc in there, or half of them through arthroscopes, arthroscopic surgery, where you put a scope into the joint and do your surgery through the scope, and you're watching your surgery on a television screen. Half of them were done there, but each of those surgeries, it is standard operating procedure in a hospital operating room where if you do surgery, you're going to take a piece of tissue out and send it to the pathologist. And out of 2,000 cases, and those pathology reports were returned 2,000 times, the first line of the pathology report, no matter what else it said about that pathology in the joint, the first line of the pathology report was chronic inflammation. So you can deduce that if you have TMD, temporomandibular joint disorder, you have chronic inflammation within the temporomandibular joint. Sometimes it didn't say chronic inflammation. Sometimes it spelled out the cell types that were seen in chronic inflammation. Got more specific. Well, these are the cell types that we're seeing, which basically converts into chronic inflammation. So you can deduce that chronic inflammation is seen in 100% of TMD.